All right, welcome to Life Extension Live. I'm Dr. Mike, and that is
Dr. Crystal.
Obviously, we have a special guest today, Dr. Olufemi Sonubi. We're going to call him Dr. O.
Perfect.
From here on out. And we're talking all about your hips don't lie.
That's right.
Hip mobility is very important as we age. And so we thought we'd have Dr. O come on and help us out with our hip mobility. Dr. O, you have a doctorate in physical therapy, right?
Yes, I do.
From where?
From SUNY Downstate Medical Center in Brooklyn, New York City.
And you told us, well, first of all, your practice is here in Fort Lauderdale, right?
That's right,
or
right
Oakland Park.
Right in Oakland Park.
In South Florida, for those of you that don't know that. Mm-hmm. You told us kind of what your passion is and what you want from people. What was that? Say that again, because it was awesome.
So in short, I like helping people live their best lives. And physicality is a huge portion of your quality of life. So I can improve the way you move, I can improve your life. That simple.
I like it. Okay. I like that, yeah. And so, today it's about the hips, right?
Mm-hmm. Yep.
What causes some of the hip dysmobility that a lot of people start to feel as they age?
So for some people, they formerly have conditions such as osteoarthritis. Some people have hip impingements, right? Some people even have hip dysplasia that starts to present itself as they age. But for the most part, most humans are lacking a quality program, right? We are severely inactive. We live a very sedentary life. So that predisposes us to stiffness, tightness, and a lack of range of motion at the hips.
Yeah. Wow. I like that. So we need a routine, right?
Yes, we do.
We need a routine to take care of our hips. Because listen, if you don't, having bad hips makes it hard to walk.
Well, I'll tell you, it's related to lower back pain as well.
Exactly. You're exactly right about that. You remember that old song when you were a kid, like the hip bone's connected to the backbone? Well, that was probably the most true thing we've ever learned as children. So if the hips are off, you're going to feel a lot of those symptoms in the back as well.
Yeah. I'm experiencing a lot of that. Trust me, I know what you're talking about. So obviously then the next question is how can we improve our hip mobility? And I think you're going to show us some stretches or something, right?
Join me on the floor.
Okay, let's do it.
Let's do it. So the first drill we're going to do is called the quadruped hip car. This is what we call an active hip mobility drill. I'm going to show you guys just how this is done. So usually when we think about mobility drills, we think more about passive stretching. Right now, I wanted to sort of shake up your experience with an active hip mobility drill. So with the quadruped hip car, it's all about slowly controlling the body in this hip motion. So you notice how slow I'm going. I'm allowing my body to experience the entire movement. I'll show you one more time.
I like that. Low and you're controlled and slow. It's not a race to see how many you can do, Dr. Crystal.
And I also see that the leg is not quite as high.
Yeah, you're not coming up. He's straight here. Yeah.
Yeah.
Okay, that's good. All right, now you're going to show Dr. Crystal?
That's right.
All right.
So
My turn.
I want you to go right in the same position I was in.
Okay.
So when I say quadruped, I just mean all fours, right?
Okay.
If you can, make sure that your wrist is right below your shoulder.
Oh,
excellent.
That's always my Pilates instructor always gets me on that.
Excellent. And then you also want the knee to be right below the hips, but bring them closer together because you are going to lift one side up.
Okay.
All right, so now first thing we're going to do, we're going to keep the knee joint here in a 90-degree angle.
Okay.
And you're going to go into hip extension up here. Now once you reach the max here, you'll know because you'll start moving at your back too much. And then you'll externally rotate the hip, keep it high, and bring it right over by your elbows. And then
higher.
Coming back in, and then you'll go up again. Make sure you keep the knee at 90 degrees.
All right.
Excellent. Externally rotate, bring it in. Watch out for compensations. Yes. Okay, now we're gonna.
In my hip.
Exactly. Now we're gonna go the opposite direction. So you're gonna go forward, right? Now up, and then that's gonna allow you to internally rotate as you come back here.
Am I supposed to kind of keep my back straight? Because I'm finding my back wants to
These are what we call compensations for increased movement.
Okay.
If you keep this back in that neutral spine position, you'll know that you're truly moving at the hip joint and nowhere else.
Okay. Wow.
Excellent. You did that very well.
Thank you.
Excellent. All right.
So I felt that like right here.
Yes, yes.
So that means that I was doing it
You
properly.
feel it really in your hip.
Yes.
That's where you want to feel it.
Yes, your glute muscle. Your,
Well,
between your
on the-
glute med and your glute max muscle to
Yes.
the back.
That's where you want to feel it. Yeah. Perfect.
Okay.
Great. Perfect. Let's go to the next
All
one.
right.
All right, so the next drill is actually a variation of the drill we just did. So the last drill was quadruped, meaning on all fours. Now we're gonna go for the sideline hip
Okay.
car. So now gravity is gonna be affecting us differently in this position than the previous. So I'm right here, my head is supported either with a pillow or with my hand, and I go up, I go out, and then I internally rotate as I go back, and then I bring it right around to do it again.
Okay.
So you're less likely to compensate at your back in this position. I would consider this a regression to the first drill. And I can
Okay.
also go backwards as well.
But it's the same general movement too. You're keeping the leg bent. You're focusing on the hip movement, right?
Yes.
But now there's just a little more resistance from the gravity,
They
which I
will actually
imagine.
resistance in a different way at a,
Okay.
right? Because remember, gravity affects the joint differently in this position than the previous.
Okay.
You want,
Excellent. Let's try it
show,
out.
show Dr. Crystal. Come on now, get up
All
there.
right. All right. Can I do a different hip?
Yes, you
Yeah.
may. Yes, you may.
Let's do a different side here.
There we go.
All right.
So now sideline, both
Okay.
hips flexed right there. Now
Okay.
we're
So
gonna,
another 90-degree
yes, at the
angle
hip
here.
joint, and we
Okay.
also are 90 degree at the hip joint, at the knee
Okay.
joint, right?
All right.
So now I want you to
I
come
lean
down. Yes,
Okay.
excellent. So now you lift this leg up to about right here. Now bring it forward, keeping the knee at 90. Remember that?
Oh yeah. Oh yes. Yes.
Then
yes,
we
yes.
go up, and then we internally rotate as we come
Oh.
down into extension.
Okay.
And then
we
we
call
go.
this a passe in ballet.
I love that. Go again.
Okay. So up
Let's do it again. Excellent.
and then back. And
Internally
again,
rotate.
I feel it in the same spot.
That's right.
Now, how long
Yes.
would I have to do these exercises in order to really?
See a change in your hip mobility? Well, that's a very nuanced question, right?
Okay.
So some people, they're stiff because of a more so, maybe they're just coming from an injury and they're more so protecting at a joint. And then other people, they have actual structural issues, right?
Okay.
At the joint that make it so that it takes a much longer for them to improve their hip mobility. So it's very dependent upon your situation. But like most things, consistency is the most important part. And we want to make this more as a habit than
Okay.
anything else.
So daily, we should do this daily.
I was gonna say,
100%.
should this now be a part of my morning routine?
Exactly.
After I put my collagen in my coffee, can I have my coffee first?
Yes, remember,
Okay.
like I said, this is a multivitamin for your hip.
Yeah.
That's
So,
right.
so for me, I have a bad left hip. We already know that. So my goal isn't try to do a whole bunch of them. It's do it slow, be controlled,
Yes.
and maybe for the first week it's only 2 or 3 on my left hip. But it'll hopefully little by little becomes 3 or 4, 5 or 6.
See, you know what I
Yeah.
like? It's you focus on the process. there.
Yeah.
The process and slowly, incrementally increasing the amount of stretches or mobility drills that you do. And
Right.
usually patients who have that mindset, they see long-term gains.
Right. So little by little, it's not a race, Dr. Crystal,
I know, that's,
because you
well,
like to race.
I'm learning and I want it done and I want it done fast. I
There-
want those hips to be moving.
There's a third one,
In a
right? You gonna
week.
show us?
Yes.
All
Now,
right.
time for the third hip mobility drill.
Okay.
This one is a little more on the passive side, but most people need this one. Secondary to the nature of society being very sedentary, especially for the amount of desk workers that we have, this one is called the hip flexor stretch. All right?
Okay.
So the hip flexor stretch is pretty simple. You're here in the half kneeling position, right? So now the side that's going to be stretched is the leg that is down, right? Your first step is to squeeze the abdomen. By squeezing the abdomen, we are tilting the pelvis back, and you squeeze the same side butt cheek. You guys are probably already feeling a stretch just from
Butt
doing
cheek
that.
squeeze.
Yes. Now that we have the abdomen squeeze, the glute or the butt cheek squeeze, then we want to lean forward without arching our back. And what you'll notice is you
I
start to
noticed my
feel,
back arched immediately. You gotta
Exactly.
watch that.
and that's why we squeeze the abdominals, right?
Okay.
Now, At the same time, now we're in the stretch position. Now without releasing our abdominals, we want to lift our hand on the same side up and prevent any arching of the back. You'll feel a deeper stretch as your arm goes up.
Oh, yeah.
Exactly. Now come back down. You always want to make sure you're breathing with these mobility drills.
Yeah, thanks for reminding. I wasn't breathing at all. Not just.
So, Dr. O, let's
Yes.
think about functionality.
Yes.
Does this, like this stretch, does this help us to get in and out of a chair? Like, how would you describe functionally how
I would say
it's
that-
helping?
I would say that this stretch sort of combats the issues that occur from us being in the chair so often.
Oh, I see.
Right?
Just
Now, I would also say, though, it'll allow us to stand up taller, right? It's gonna allow us to feel less tension at the front side of our hip, right? Which is great for walking, taking bigger strides, right? And also it's gonna release a lot of the tension on our low backs. Let's switch it
Okay.
up. If you guys notice, even just changing sides is like a hip mobility
It
drill.
is. If
You
I
see
felt that too, yeah. That's why I grunted.
Exactly. So let's do that other side. First
Okay.
things first, remember the glute squeezed, the abdominals squeezed, and then we lean forward without arching our backs. Then you really start feeling that stretch.
Right there.
And now we lift the arm without arching our backs. You feel the stretch a little bit more.
Yes.
Excellent. You guys are
that
crushing.
feels good, though. I'm
does,
telling you,
yeah.
it really feels good,
For me,
Dr. Mike.
it's really pinpointing like my area that I know I have a problem with.
Exactly. See, the hip flexor muscle is very interesting because there's hip flexor muscles that attach at the knee joint, at the hip joint, and the lumbar spine. So you could have dysfunction at any of those areas
Yeah.
secondary to a hip flexor
Yeah.
that is too tight.
Right. Gosh, that's fantastic.
And so, how deep would one typically go? Because this is one of the stretches we sometimes do after my Pilates class, and I see sometimes people are just all the way down.
That is great. I love that you answered that question. You asked that question. So I always say you never want to like follow other people when they're stretching. We all have very different bodies, right? And some people
Not a
are actually
competition.
some people are actually compensating via their back to get deeper into many of these stretches.
Yeah.
So they think they're stretching their hips, but actually they're just curving their lumbar spine a lot.
Okay.
So for you, I always tell people you want to stretch into minor discomfort. Minor discomfort is how far you want to go. When you get to a point where it feels like, oh my goodness, I feel like I'm about to tear something, you know that you're stretching way too deep.
Okay.
That's a good
That's a good point. It's not a competition. That's what I
Yeah.
have to take away because I look at all the people
She
around
does,
me,
yeah.
and I'm like, I gotta go.
I
deeper.
could do that. I'll do that in a week. You watch. I'll surpass him.
Yes, yes.
I know Dr. Chris.
Understandable. Very common. Very common.
Yes.
Well, Dr. O, you can stand up now. Thank you so much for joining us today.
Of course.
Fantastic. 3 hip stretches. You really should give those a try. I felt it, didn't you?
Oh, absolutely.
Right.
It feels, and they feel a little looser now.
That's right. That's right.
Because hips don't lie.
That's right.
Dr. O, Remarkable Recovery and Rehab. That's your clinic, correct?
That's right. That's the name of our practice. We are the performance physical therapists in the greater Fort Lauderdale area. We serve mostly recreational, youth, and pro athletes. Anybody who wants to get back to high-level activity and live their best life.
What's the web address?
Remarkable with 3Rs.com.
Dr. O, thanks for joining us. Dr. Chris and I will be right back to talk about nutrients. Stay tuned.
Excellent.
So, Dr. Crystal, that was a great
Yes,
demo.
It was. I can feel my hips. They feel looser.
Yeah. I loved the way Dr. O was very specific about being slow and controlled with the movement, right?
I like that. And
Right.
doing what you're able to do and don't, because you'll find that you're overcompensating.
Yeah. It's better to do it right.
Exactly.
And even if you can only do a couple of them right now,
Yeah.
that'll improve over time if you're doing it right.
yes. So now
Uh-oh.
it's all about, it always comes back to nutrition for me.
Right. No, I agree. And food first, nutrition first, exercise first and a half. All right, let's. We just wanted to share some pretty good research here. These are nutrients in different combinations that overall in clinical research have been shown to improve joint mobility, inflammation, a bunch of different things. The first combination is turmeric and tamarind seed.
Yes, and what we like about these two is they are targeting inflammation.
Yeah.
The inflammation is really that root cause of a lot of the discomfort and the pain that we feel is due to those pro-inflammatory mediators that's mediating that pain. And so
Right.
we know that turmeric has a long history of being an anti-inflammatory nutrient.
Well, it's one of my go-tos.
Yeah.
Along with fish oil every day, powerful anti-inflammatories right there. This combination was 250 milligrams of the tamarind seed, right? 400 milligrams of the turmeric extract, which those are good doses.
Well, so the combination in research, those are two of the doses that was used in the
the
studies.
total of it. I see what you're saying.
Exactly.
Okay.
So in that combination, the total amount, we see that the two doses were compared in research.
And what as you just mentioned, they inhibit inflammation, walking speed and range of motion improves with these, helps to reduce or limit age-related decreases in mobility, and just supports joint comfort pretty much all day with physical activities, from just sitting up, walking, basic stuff.
Yes.
Yeah.
Yes, and so we need our joints to be flexible and comfortable.
Yeah. This goes back to the idea, most of you know Dr. Krista and also have the podcast Live Forever-ish.
Yes.
And this goes back, we talk a lot about what Live Forever-ish is, and it all usually ends with muscle strength, muscle. You got to be able to stand up. You got to be able to walk.
Right.
Without needing aids and help. I mean, that's living forever, and this kind of stuff is important.
Yeah, decreased range of motion, lack of mobility, that limits you from getting out and being active as well. So anything that can keep you moving, keep you functional, to be able to lean over to pick up
something
your
up.
bag of groceries.
Yeah.
It's about the quality of life.
Perfect. We also have a combination of white mulberry and Chinese skullcap, which is an herb from the mint family, and Kutch tree. Tell us about that.
Yeah, that Kutch tree, you may not have heard of that before. That's in the legume or the pea family as well. What's really nice about these nutrients, they again have been studied in combination. And the combination, some of the research, again, is showing to target specific pro-inflammatory mediators that are increased when we eat a lot of the sad American diet, right? That's the fried foods, the red meat, a lot of the processed vegetable oils can kind of trigger pro-inflammatory occurrences in the body. And so we know that this is targeting inflammation, but we also have the clinical research to also show that it improves clinical outcomes.
Right, which is so important, right? We can talk about the combination here, decreasing those pro-inflammatory enzymes and markers, but at the end of the day, does it mean anything to do that?
But I'll tell you,
it does.
It means something. This one study, it's just so important to highlight because the combination of that Chinese skullcap, that's the herb in the mint family, and the Kutch tree was compared to an everyday over-the-counter anti-inflammatory, NSAID, which is a lot of people's go-to,
That's a go-to,
when they are experiencing pain and discomfort. So we like the studies where, they're randomized, placebo-controlled, but they also have an active control.
Right, comparing it to the standard, kind of a standard of care.
That's right. And so we have that research here with 52 subjects with knee and hip arthritis.
Right.
What we're talking about today.
Yeah, the hip mobility stuff, and the combination did just as good, if not better, in a couple scores, right?
Yes, we did see that more effective than 100 milligrams of that NSAID twice daily. We're seeing in 30 days, 250 milligrams twice daily, which is 500 milligrams per day, was statistically significantly more effective at pain relief.
Yeah, and of
The
course,
power of herbs.
and when you hear that, that's exciting because in general, the herbs, the natural extracts, they're going to have less side effect issues. And so, yeah, why not go with your maximum effect, low side effect? That'd be the herbs here in this case.
Yeah. So
great.
just a couple of nutritional options to pair with those exercises.
You got to do it all. Right? You got to do it all. Don't just take the curcumin and say, like, you got to get there and stretch and move to keep your hip mobility exactly where it needs to be so you can go a long time in life. Moving and grooving because hips don't lie. All right. By the way, if you're interested in more exercises, there is a wellness article at lifeextension.com/wellness where there's a whole bunch there, actually.
We have lots, and you can kind of use the filter and go to the exercises. We have yoga exercises, functional exercises, swimming exercises.
It's all on that page, right?
Yes.
That's lifeextension.com/wellness. And while you're there shopping around, don't forget you can use the discount code LELIVE for 10% off $50 or more plus free shipping and handling. That's the code LELIVE. Hey, every Wednesday, 12 noon Eastern time, what do? We go
live.
That's right. So wherever you watch us, subscribe, hit interested so you always know when we're about to go live. I'm Dr. Mike. That's
Dr. Crystal.
We'll see you next time.